Thank you, Dr. Loaiza Bonilla. It's such an incredible, important topic to talk about, access to clinical trials, especially during COVID-19. We've seen, unfortunately, a lot of patients go through this. So, I really appreciate the conversation. So I'm Micheal, and I'm going to be talking about support systems in GI cancer, specifically colorectal cancer, but I also talk about others as well. I'm going to start actually though by telling a little bit about myself and my background. I think this actually goes a long way in terms of how I, as the CEO of the largest colorectal cancer advocacy organization in the world, have helped our patients and our staff move towards creating more empathetic, more precise, more precision-based, support systems, for the 1.4 million Americans that are living with colorectal cancer right now. So, unfortunately, my mom passed away from colon cancer on Mother's Day in 2009. I was in my late 20s. I was actually performing as a classical musician, performing all over the world. You can see the music behind me. These were actually two pieces that I bought for my mom in Vienna, Austria. And to make a long story short, in 2006, she was diagnosed late stage, being treated at Georgetown with Dr. John Marshall. And unfortunately, as I said, in 2009, she passed away. And at that time, in 2009, the largest colon cancer advocacy organization was the Colon Cancer Alliance. Now it's the Colorectal Cancer Alliance. And the organization had a budget of about $1 million. And, I thought to myself, and our family said, what is happening? Susan G. Komen's raising $500 million. Leukemia Lymphoma Society is raising a lot more than that. So why is colorectal cancer the second leading cause of cancer-related deaths for men and women combined, yet we're raising $1 million as the largest advocacy organization? So, our family started what's called the CRISP for Life Colon Cancer Foundation. And when we merged with the Colon Cancer Alliance in 2016, we have tripled in size since then, both staff, our impact on our three programs. And, growing up as both a musician and someone who, was disenfranchised. I'm a gay male in the United States here, married to my wonderful husband, Nathan. Thinking about diversity in cancer care, which I know is a lot of topics that we'll be, talking about during this entire program. I often look at supporting patients through that lens, and whether that's health disparities. So I'm going to talk a little bit about screening for our Black and Brown communities, whether that is as Dr. Loaiza Bonilla was talking about, these access to clinical trials, whatever it is, how are we making sure that we look at this through not only the disparities lens, but from an actual patient and survivor lens? And, seeing my mom before she passed in just horrible pain, it has stuck with me forever. So, I really appreciate everybody tuning in today, and I will do my best to kind of give light to the programs that the Alliance has, but also maybe talk a little bit broader than that about other programs that are available and support systems that are out there. So I'm going to move on now to talk a little bit about the Alliance. As I mentioned, the Colorectal Cancer Alliance is the largest advocacy organization in the world for colon cancer, colorectal cancer. Most of you probably know colorectal cancer is a disease that looks pretty much the same under a microscope in the colon and in the rectum, but in two different locations. You notice I did two different locations here. The Alliance really concentrates in three areas. Their screening program, or we call it SCREEN, our patient and family support program, or our care program, and research, and that's called our cure. So we screen, care, cure. So I'm going to start with SCREEN. And I'm actually going to start by talking a little bit about I call it a little bit insanity, because, why in the wealthiest nation in the world do we only have, we still have over a third of our at-risk public not getting screened. And then if you look at the health disparities, 20%, African Americans are 20% higher risk for getting colorectal cancer, their incidence rates, and 40% more likely to die from the disease. So, we have a ton of work, and that's right now. And in light of the tragic passing of Chadwick Boseman, it's really been brought to light in the colorectal cancer space around, these huge inequities, in screening. So the Alliance actually is about to launch an entire public awareness campaign, what we call it the Now Normal. So really trying to get patients and families and back into the physician's office to have a colonoscopy, to have a FIT test, to have a Cologuard, to have a CT colonography. Whatever test is the best test is the one that gets done. So we'll be launching that campaign in about a week. And then that actually will lead people to this navigation tool. So it will be a first of its kind portal questionnaire that actually navigates patients through the entire continuum of screening. So for those of you that know, the biggest barrier to screening is navigation. Yes, there's the fear of having something where the sun don't shine, or, what other non-invasive tests do I take? Can I do the at-home Cologuard or the at-home FIT test? But it's really making sure that people sign up to do that test and actually get through that entire process from the beginning to the end to get it completed. If they have a positive stool-based test, to actually go back and get a colonoscopy. So we'll be launching that in 5 different cities, and then by January in 15 different cities across the country, and really concentrating on 2 different categories. One, Black and brown communities. As I mentioned, 20% higher incidence rate, 40% higher mortality. And the second cohort is the 50 to 54-year-old cohort. Their screening rate is about 49%. So less than half are getting screened of people 50 to 54. And this really hits home for me. My mom was 56 when she was diagnosed. She had never had a screening before, and she was 59 when she passed. So that group is so incredibly important. If you look then, that's our screen pillar. If you look then at what we do for patients, this is really where our support services, our support systems, I think are best in class. Really, the Alliance was founded on this 21 years ago. It's actually a great story. They were on this March on Washington for cancer, and there were tables for every different type of cancer, but colon cancer, colorectal cancer. And these 30-something, 40 individuals who were made up of survivors, patients, a lot of them unfortunately have passed, some philanthropists, they said, we've got to do something. And what did they do? They created the first listserv. You probably remember the old AOL or just URL-based listserv, tiny little letters where it kind of goes on and on and on in the page. And it was one of our founders, Jeannie Moore, who's still on our staff, talks about it all the time, and Kevin Lewis on our board, how those early days, all volunteer for about 10 years, people really just, making sure that patients and their families weren't alone. So you take it from there to where we are now. So 2020, last year we supported 300,000 plus patients through our entire care and support systems. And I'll talk a little bit about them. So the benchmark is our navigation program. So we have 5 or 6 navigators on staff, ranging in different topics. Some are concentrating on metastatic colorectal cancer. So really kind of walking people through that continuum of care and that journey, whether it's looking for clinical trials, whether it's looking for a second opinion, whether it's just making sure that, if they're having a bad day and they're upset and their husband or their wife or their kids or whatnot are challenging them, that, we really, support them through that journey. We have a caregiver buddy. We have young onset buddy. We have somebody that concentrates on men. So kind of the whole continuum. And that really is fed through our helpline. So we have a toll-free helpline. We have a buddy program. So where you actually match patients who have gone through like experience and caregivers who have gone through like experience, excuse me. So, let's say, I lost my mom. I was a caregiver to my mother. So how can I support other maybe sons? And I've done this hundreds of times throughout, the last 10 years since my mom died. So that buddy program is one of our most robust programs. And we have buddies that have been active for over 20 years now. Just quite amazing in how they match up with individuals. And then if you think about, so we have the helpline, you have the navigators, you have our buddy program. We also have our clinical trial finder, and that kind of goes across both the care and cure pillar. So all of us know how confusing clinicaltrials.gov is, especially the physicians that are listening. You guys understand it, but patients, they have not a clue. Do they even know about their biomarkers, right? And I'll talk about that in a second, that whole education program that we have, that support system to make sure that patients are up to date on all that information around biomarker testing and all those sorts of things that are so incredibly important. But, you know, the clinical trial finder is vitally important to make sure that patients are seeking out life-saving treatments, whether that's right when they're diagnosed or when they actually need a clinical trial. We try to enter it in that user experience, or as we call a customer journey. Even though that's a for-profit term, it really, for nonprofits, has to be front and center for us. How are patients coming in to use the clinical trial finder? How are they coming in to use all of the different services that we have? So really important. And then we have what we call our financial assistance program. So we help patients all across the country with financial assistance, you know, whether that's treatment assistance, whether that's screening assistance. We've really upped through our, what we call our Care for COVID fund. We started that obviously after the pandemic started. We've, I think, served over 70,000 people now since the beginning of the pandemic through this Care for COVID fund, not just with financial assistance, but with all the programs. We have our yearly national conference. We call it AllyCon. This year, unfortunately, we have to go virtual. I want to give a big shout out to Neela Azad from Johns Hopkins. She's acting as our kind of like medical director for this. So far, I think we have 500 patients signed up for it. We're normally only have 200. So we're hoping that this virtual experience will be second to none. And let me just talk a little bit about that support service. So the actual conference. So oftentimes, you know, we think about conferences as a place to, you know, you bring doctors and they're talking heads and patients are supposed to listen. Well, us at the Alliance, we have kind of the complete opposite approach to this, which is how, number one, do we build community with patients? First and foremost, patients want to feel like they aren't alone. And how, when even an online experience, how do we make sure that they feel like they are with experienced people? So, you know, they're at home, they're with their kids, they're with their husband, who, yes, are very empathetic, but don't necessarily kind of truly understand what they're going through. So number one with this, our conference, it's all about community and how do we build that camaraderie and those, you know, conversations that are hopefully happening in a private, more, you know, however you would say it. And then the second part is, yes, education. So we will have brilliant physicians on the cutting edge of immunotherapy, cutting edge of rectal surgery, cutting edge of all the different things that might apply to a patient's journey. But as part of those plenaries, or whatever we want to call them, you know, there are patients on all those panels. There are actual case studies, tumor boards, et cetera. So it's not, I'm giving a presentation that I would give at ASCO or GI ASCO or, you know, ESMO or whatnot. It's that this is really relevant to this patient or these patients in the audience. So that's our AllyCon, you know, program. The last piece I'll talk about around our care pillar is our online communities, and then how does this all fit together? So, you know, I think this is what, 6-7 years ago where, you know, social media started exploding. And so we have what's called Blue Hope Nation. That is our online colorectal cancer platform that is based on Facebook. We have, I think, around 12,000 people in that group. And it is made up of survivors, caregivers, philanthropists, volunteers, doctors, and hundreds, if not thousands of posts and interactions a day. And we also have another platform called Ally to Ally, which is actually our platform where it is URL based. And the big difference is we have small groups for different types of diseases, different types of subsets of diseases. So we have one for metastatic, we have one for men, one for women. It's similar to Colon Town, very, very similar, but a little bit more URL based, not on Facebook. So this is called Ally to Ally. And it really allows the Alliance to both track people. So meaning, let's say someone's talking about a BRAF mutation. How do we then get that person information about BRAF? Facebook, you can't do that. And it also allows us for them to be in a private group and to see and track their volunteer hours. There's gamification on Ally to Ally and all that sort of stuff. So we're really excited. It's kind of like the cutting edge new online community that, you know, folks hopefully can participate in. So let me just talk briefly about the cure pillar. that the Alliance has. So we fund research in a bunch of different ways, mainly young onset, health disparities, biomarker research. We also do some intramural research. We do a bunch of surveys. We publish manuscripts, abstracts, et cetera. We have for 4 years in a row done the Never Too Young survey. I think most recently we had about 1,600 people fill out that survey. As you probably know, or maybe you don't know, young onset is on the rise, about 2% annually. We're seeing a huge increase, especially in the 40 to 49 age group, although we know tons of patients even in their teens. And I think it's vital. What is different biologically, potentially, with these patients under the age of 50? And or is there a way for us to, get another type of screening test that's non-invasive, that's less expensive, that we may be able to offer for people under the age of 50? The Alliance and the American Cancer Society, the Colorectal Cancer Alliance and American Cancer Society, both have endorsed this 45, screening at 45. The Preventative Task Force in October should be coming out with a recommendation. Fingers crossed that they will recommend for 45, if not younger. And that will be a big step forward to saving a lot of lives, for patients at least ages 45 to 49. So I think the last, two things that I'll talk about before I wrap it up. One is other support services within the GI cancer realm. So there are lots of major organizations in the colorectal cancer space. There's big organizations in the pancreatic cancer space, in the stomach cancer space. I think the largest in the pancreatic cancer space is PanCan. They have done an absolute tremendous job. I would really highlight and recommend you check that out as a resource. They have both clinical trial pieces, they have biomarker, they have a helpline, they're doing their own research and their own clinical trials. They really have, their mantra is double survival by, I think it's 2022, if I remember correctly, but a really great organization. I would really highly recommend that. And then the Alliance, the Colorectal Cancer Alliance, is also part of another organization called the GI Cancers Alliance. And Georgetown and a bunch of other people, I was a founding member, the Alliance was a founding member. Martha Raymond is I think she's the CEO, I'm not exactly sure her title, but I would highly recommend looking up the GI Cancers Alliance. There's a lot of different information and education tools, specifically around caregivers and others, really to help, again, with that support system for patients and their families. I think it's GI Cancers, GICancerAlliance.org. And I think the only other two organizations I would bring up would be Cancer Support Community, which is, it was a merger of the Gildas Club and Cancer Support Community. They have affiliates all over the country, both in person and online. They also have a helpline, but they also do a lot of really great policy work. And then the other main organizations I would bring up is Cancer Care and Patient Advocate Foundation, specifically around support services for insurance, co-pays, any of those really deep navigation issues. So we have a navigation program and we go pretty deep, but when it gets to a really hard insurance issue where they're fighting with insurance companies, et cetera, and we can't handle it, we will pass them off to either Cancer Care or Patient Advocate Foundation. They do a really, really great job. They also have financial assistance programs, as well as that, support system. So I think I'm going to conclude by just saying thank you for allowing me to be part of the show today, and I hope you will visit ccalliance.org for more information. Colorectal cancer is one of those diseases, and GI cancers in general, which are totally unrepresented with funding, et cetera. And I'm really excited to be part of this program. And remember to tell your patients to be their own advocates. Thank you.